Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hey everybody, welcome back. I'm so excited to have you today, and today we're going to have an amazing guest speaker. Just before she arrives, I want to remind you about the Backlog Buddies, which is having our summer sale right now. $10 sessions, and every time you join a session in June of 2025, you have a chance to win a year's supply of Backlog Buddies sessions. I'm so excited for you to be able to access this service where you've got 2 hours of dedicated time where you can get your backlog done. So take advantage of that, and I'll see you in a session soon. Okay, so Dr. Linde Corrigan is joining us today. I'm so excited to have you here. Welcome. I will let you introduce yourself.
Thank you. Hi, I'm Linde Corrigan. I'm a family physician in the Ottawa Valley in Ontario, and I do a bit of family medicine, a bit of care of the elderly in the hospital, some procedures, tongue tie clinic. So rural medicine allows me to do a lot of many different things.
Yeah, that's so good. That rural generalist of all the things. And you specialized in the elderly medicine. Is that right?
Yes, in a way. So I finished my residency, and the physician that was in the care of the elderly role at our hospital was moving on, and they didn't have anybody. So I just fortunately fell into that role, and they were training me on the way, and I
Mhm.
went to different, you know, courses and shadowed different professionals, and then I was able to apply for my additional certification. So it's the
Yeah.
equivalent of a plus one,
Yes.
but it was nice because I didn't have to go to residency, have my schedule dictated. I was able to make staff money.
Yes.
So it's kind of nice that rural medicine allows you to do that.
Yeah, totally. That's really, really good. So tell us about your journey through medicine or residency, things and challenges along the way.
Yes, I found residency very challenging. I felt very different than my peers, and I think part of me was worried that um, what is that syndrome that oh my gosh, the syndrome that everybody has,
Oh, imposter syndrome.
imposter
There
syndrome.
we go. Imposter syndrome. Yep.
Maybe it says like I'm coming a long way that I couldn't remember that name because that's amazing. But
That's good.
had felt that so much. I remember my friends telling me this is just imposter syndrome, and I kept saying, yes, but if you are an imposter, you will be reassured by the syndrome of imposter syndrome. So I can laugh now at how ridiculous that sounds, but I really felt that I had somehow wound up in a place where I didn't belong. And then during that challenge with my learning differently than others, I did find out that I had a diagnosis of ADHD,
Mhm.
which did explain a lot of things and actually um, made me feel a lot better about
Mhm.
understanding myself and the way my brain thinks.
Got it. Yeah. Tell us about what was challenging for you that you realized was the light bulb moments. What was it that it looked different to you than your peers, perhaps?
I really felt so much slower.
Mhm.
Everybody's mind was thinking so much quicker. Documentation in particular was very challenging. We would write with pencil in the hospital or pen, paper notes,
Mhm.
and it, I would just stop writing. I would realize that my thoughts would be elsewhere.
Mm.
It would take me a long time to even write a short note.
Mhm.
In the clinic, when we were using more EMR stuff, I was able to see that that was happening because there was a timer at the end of
Mhm.
my progress note. And so when like 5 or 7 minutes elapsed and I only had a few sentences, I was starting to realize like what happened with that other amount of time? I couldn't even account for it. So that was
Yeah, okay.
difficult.
Mm.
Yeah.
And did you have somebody else identify that for you, or is this something that you felt like you were constantly struggling with and you went looking for answers?
I was having a lot of trouble with residency. it was very difficult. And talking to a friend of mine in the same program, she had said, I think you should get your concentration assessed.
Hmm.
Um, and I was surprised. In medical school, I actually had thought I had ADHD, but when I approached the guidance um, group at that time, they suggested that the testing is very expensive, so perhaps if you could, like, during a lecture, make a little tick note if you weren't paying attention, and then
Hmm.
you can kind of measure it. But the problem is, if I just don't pay attention the whole time, I only get one tick mark. But if I keep trying to pay attention, I have more tick marks. So it didn't really make sense, and I guess it just
Hmm.
kind of put a barrier to me
Mm.
thinking about that any further. But at the time too, we kind of thought if people were in medical school or in university, then they didn't have, there was still a little bit of that. It was changing, but
Mhm.
there was
Mhm.
still a bit of that.
Yeah, yeah. Okay. So what did you need to be able to help you kind of overcome some of those challenges that you're having?
Um, yeah, I was very lucky that my family doctor set me up with a specialist. And so, with meeting with him frequently, I was able to understand a little bit about my difficulties. And one thing he suggested was, you have to write your note after every encounter because
Hmm.
you won't remember the details. And and he said it's not safe. And because he said it wasn't safe, it made it scarier to
Hmm.
be for real. And that's such a huge takeaway from your program too.
Hmm.
But it is really hard to change to do that. It really feels like when you have someone waiting. So I think it helped at that time that I was starting that practice during residency, and I had felt that someone had told me to do that. So my people pleasing abilities then were diminished because someone had told me to do that.
Yeah, okay. So that was a helpful tool for you to be told you need to get your note done at the end of this patient. It's safer for you. You won't remember the details later. In your case, you're going to have to make an exception to get this done.
Right. Yeah.
And it's part of the tools, which is really helpful of you being able
Yes.
to get your work done. So that's excellent. I love that. I love that he said that to you. I love that you listened in a way that made it easy for you to do, even when you had that people-pleasing desire to move to the next patient or
Right.
move to something else, another task, and you're like, no, wait,
Yeah.
safety.
Yep.
So good. Yeah. Was there any other things that you needed?
Um, doing the testing also helped me learn about myself. So it was kind of interesting to learn how my processing abilities were so slow on those processing tests. And
Mm.
I had didn't realize that part of processing was thinking too hard about something and changing my mind and thinking again. So, for example, one of
Hmm.
the tests was like strike out all of the symbols that look like this and not like this, and do it as fast as you can accurately. And then I remember asking the tester, is it more important to do it faster or accurately? And of course, they can only say the same sentence over and over. And so I remember even when they said that test was so low, thinking, oh, but that was because I could go faster, but I was thinking back and forth about the symbol or going faster or making mistakes is okay, but I want to go fast. So it made me realize, well, that is part of processing that my mind will talk myself out of something and talk myself into it, and it's hard to move on from that. So that helped. But then what I will mention to pat myself on the back was that my visual memory was very good.
Hmm.
I got to the end of that in the intelligence testing, which made me feel so happy. Um, and so then I changed the way I was taking notes in conferences. I was mostly going to conferences at that point. So I kind of have my iPad and I scribble and I doodle and I take certain pictures of what's going on and I take certain recordings of what's going on. But so it makes it a bit of a game. And then because I'm making things really visual, it helps me remember. So that was something that really helped as well.
Excellent. When you're in with a patient, do you do similar things to help you stay, to help ground your focusing or ground your process decision making?
I haven't figured that one out totally, but
Hmm.
it does, confidence has helped. So I notice in a situation where I get less confident, then I'll go back and forth about a plan,
Yes.
you know, option in the plan.
Yes.
And in the big picture, it doesn't matter what they do. It's kind of like just pick one and then see if,
Yes.
you know, whether they take the medication or try the non-pharmacological approach. You know, it doesn't
Yeah.
really matter. But yeah, sometimes when my confidence is shaking, I will say one thing, but then in my mind will be thinking about the other option and how maybe it's
Mhm.
better in a certain way. And so it waffles, which is harder for patients to take that in,
Mhm.
right? They really like to have very simple instructions.
Yeah. This is such an important thing. And a lot of our early colleagues will know this feeling so well, where you're just looping between what do I do next? What's the right next step? When they loop, it's like feeling so overwhelmed because you're not sure if you should confidently say, we'll put you on this medication, or we'll do this test, or I think it's this diagnosis. And that desire to get it right. Like you said in that test you were doing, do I make sure I am accurate or do I try and go fast? And
Yeah.
even that decision, oh, well, I can see us inside the consultation going, well, I'm trying to get through the patients fast, but then I get to the part where I've got to actually say what I think's going on or decide what I want to do next. And I just kind of get stuck in this looping. And I know that for myself, I recognize this, and there were still some types of presentations that I would get stuck on, even 15 years into your career. You have a type of patient come in and you just get stuck in the what do I do now? And the back and forward, back and forward, back and forward, trying to figure it out in your head. And that light bulb moment for me was when I realized that we're never right in medicine. It
Mm.
doesn't matter what I do because there was at least two or three other people's opinions. And it came when my colleagues would walk down the corridor and they'd knock on my door and they'd say, I've got a patient with this and I want to do this. And I'd be like, why are you asking me? How did I get to be the nominated knock on the door doctor? For the longest time, I was the one who'd walk down the corridor and knock on the door and be like, I've got this patient with this, this, and this, and I think I want to do this. And they'd be like, yep. And now they're coming to me for that. Like I must have got old there somewhere. I didn't notice. I'd
You
been around
became
long
the,
enough to help them.
yes, you became the attendian attender,
The attending
attendant.
attender. And I'm like, wait a minute. So it was that step back and say, wait a minute. Like you said, does it matter if they want to do lifestyle first and then take my meds next? Or if we start meds now, but they think about the lifestyle part? No, it doesn't. So I can just say, would you like this or this? Or I could say, I'm going to start this. Is that okay? And then they could give me their input. And then I could make a plan based on what they said. And it could stop the looping.
Right. Yeah. Absolutely.
Was there anything else you used to get that confidence, that ability to stand on a decision and go for it, even if you weren't certain?
Hmm. What you're describing, I feel like is something I've never known, but I've come a long way. I do feel sometimes more confident in medicine than I do choosing out colors for things or making decisions about my kids. So
Yeah,
it must have come, but yeah. I don't
yeah,
know how to get that. I do find it interesting to meet different people and learn different things like your course. Um, I was lucky that I met this physician life coach because she was training to be a life coach, and so she needed people to test on, and so
uh-huh,
I very enthusiastically volunteered.
yes,
Um, and I think one of the tips that she had suggested to me, because at this point I had these really long geriatric consults, and
yes,
I was getting them done like by 7 or 8 p.m. and it was really only
yes,
seeing two in a day. And
yes,
so it was crazy. And one thing she talked to me about was the reframing, which is a big theme in your modules as well. And yeah, that was a big light bulb for me because I didn't really believe reframing to the positive would be so helpful.
Hmm.
So the thing she was saying, well, the write up is the thing I have to do last. I can't choose to do it first because I need to see the
Yeah.
patient and review all the labs and everything. So I have to do that last. But she was saying, it's the last thing you do, and then you get to go home. That's actually really exciting to be at that part in your day and to try
Hmm.
to think about it like that and maybe give yourself a little treat, like a tea or something. I'd pick chocolate, but she encouraged the tea. Um, and and so just changing that, it did speed me up and it actually really blew my mind apart because I always attributed my successes through life and academically because I was the hardest on myself. So
Hmm.
think that I was actually just putting barriers in my way by being hard on myself. Like, come on, Corrigan, you got to do this. You got to get home, you know?
Yeah.
Um, that was actually making it worse. And then when I was
Right.
just getting excited about it was when I
Yes.
could be quicker.
Yes.
I still forget to do that though. That's not just an easy tip that I've checked off and now I have it. It's
Yeah.
actually just even thinking about this podcast, it was like, oh, I still kind of hate when I do those reports. I have to remember to go
Yeah.
back. That was something that was very helpful.
Okay, good. So the reframe was when you would get to the end of the day and your automatic, the way you had taught yourself to do end of day to get the report done was to be really mean to you and say, come on, you got to get this done, work harder, and be your
Sure.
hardest taskmaster on yourself. And the
Yeah.
reframe was actually, this is the good part because you get to go home after this.
Yes.
Okay, and that sounds like a little bit, like you said, quackery. Like, that's never going to happen.
Yes.
Why would that work? That's
Yeah.
false advertising, really.
Yeah.
But it was a different way of speaking to yourself as you get to that part of the day.
Right.
And
Yeah.
then the little bit of reward, like the tea or the chocolate, the gamifying, like the timer that the pieces that you've had. We may get talk about them in a moment. Um, can be ways, or the other gamification that you'd done for something else you were doing that was gamification earlier. They're just ways that can help us make it a little bit more fun. How can I make this easier? How can I make this fun about the report part? Well, the first step is I can done, I get to go home. Yay! I get a reward for doing this. Yeah,
Yeah.
yeah.
Her analogy to me was like if you remember in your training, you've had like 6 days, or 7 days working in a row, and how tired you feel that last day. It's just exhausting. But you feel totally different, even though it's the same week if you happen to be going on a plane on a trip right after,
Mm,
you know? So it didn't matter what you did, it was what you were looking forward to
mm.
that changed your energy and how you
Yeah.
felt.
Absolutely. I love that. That's really helpful. I think a lot of us get to the end of the day and we're looking at those unfinished tasks and we're just dragging. We don't want to. It feels too much. We feel like we're being punished. And just having that, hey, I get to go home soon can be a
Yeah.
really different way and energy. Yeah, love that. Good. Yeah, excellent. Okay, so you had a life coach. She taught you some reframing. That was helpful for you to notice how you were punishing yourself and that you didn't have to do it that way anymore. There was other ways of doing it. That's really helpful. Yeah, yeah. Okay.
One other thing learned too is what I would call my Spidey sense. I wouldn't listen to it. So mostly when I'm doing inbox stuff, for example, I liked to do things very much in order. So even if there was a more high priority task that I could see if I was scanning the list, I just really liked to do things in order. And that took me a while to leave. But then I realized I'd have a Spidey sense or an emotional response to a certain message or task that I had to do. And by doing it in order and not doing that one right away, it was kind of hanging over my head. Um, but it usually meant it was the important task to do,
Mhm.
even if it was, I kind of felt like if it was a kind of a grumpy patient that you've had negative things, I thought I shouldn't do their thing first just because they're grumpier. But
Yeah.
sometimes it helped to either de-escalate something or so I would pretend that I was a superhero and that this was my magic power, which is probably the worst power ever if you had to choose. But if I pretended this was my power, it was hard to ignore it, right? Like Spider-Man
Mm.
Your Spidey sense. Oh, that's the emotional reaction I have to that tickler where I have to complete that form. That means I have to do that one. That's the one I have to do right now,
Mhm.
which I guess goes against the reframing. But then I found that it did make the inbox and not saving those, it did help a lot too. Yeah.
Oh, I no, I love that reframe that this is my superpower, and if I can do this, it de-escalates both my anxiety and perhaps a patient's escalation of an issue or the crankiness from the girls at the front or the extra messages I'm going to get from staff if I don't get that one done or and the constant interruption or bother by have you done that form yet or whatever that is, getting it off your plate but in a way that says, this is my superpower. I can identify the things that are going to keep coming back to haunt me until they're done, and I'll get that done even though I don't want to. I
Right.
know that by doing that, I'm actually helping me, helping my staff, helping my patient. That I love that actually.
And your
That's
module
very cool.
helped me with even piecing that theory together because you were saying the brain wants to avoid pain, right? So I
Yep.
would even be talking myself out of, I would be gaslighting myself. I didn't really have an emotional reaction to that. I'm fine with doing that form. Just keep scanning, you know? But then I would realize that I'm talking myself out of a task. So that was the
Mhm.
task that I needed to do.
Yeah, I love that. That's so clever. So very clever. Yeah, yeah. Now you were talking about when you're in the Chatting Champions group, the chat forum, magical. Tell me about magical. What is that?
Yes, that's something I learned from the Facebook group. It is a Chrome extension, so it's free, or there's a free version that I use. And so what it does is it allows you to create short form keys, and then you instantly have a message. So I know in my EMR I can go and click a template, and that takes even just 4 seconds to kind of pop up. But this one, if I click asterisk BP, as soon as I hit that P, there's a sentence that's saying, nursing, please ask this patient to send us a blood pressure, or they can alternatively, they can book in for one. So just
Hmm.
by three types of the keyboard, I have this long sentence that I end up writing quite a bit. And so I
Hmm.
found that that's helpful. I think, in fact, there's even more in Magical that you can do, but I haven't explored that
Hmm.
yet. But I've even found just those things very difficult because with my processing, just even typing something will slow me down. I'll lose my train of thought
Yeah.
or something interrupts. So just those very monotonous phrases, by having them done very quickly, was very helpful.
Yeah, okay. So this was a way of getting shortcuts if they weren't part of your EMR or were using, yeah, love it.
That's
Okay.
right. So it is Google. So when I, for example, use my pages or document, it doesn't work because I guess that's not internet based. My EMR is Oscar, so it is internet based, so it works well for that.
Excellent. Look at that. That's so clever. Being able to use extensions that aren't part of the EMR to make the EMR work even better for you.
Right.
Yeah,
Yes.
yeah.
I can't take credit for that. That was someone from a Facebook group. It was really
Oh
good.
yeah, but you've implemented it and it's been a tool for you. And I love that we've got lots of tools in your toolbox that you're using and able to share for other other physicians who are struggling with this. Tell us about you in the room with your patients and your time awareness.
Oh yes. Okay. So I have a big problem with time blindness. I didn't realize I was one of those people that you can't get away from when you're talking. I experienced that with other people, but I didn't realize I was that person, and I just had no sense of the passing of time. Um,
Mhm.
and this came out in one of my sessions too. And so what I would do is I would put a timer on my vibrating smartwatch. 2/3 of the way through an appointment. So, for example, 18 minutes through a 30-minute appointment. And that was my goal to wrap up around then and leave. And then I'd have ideally 10 minutes to do all the things.
Mhm.
And it worked well because um, sometimes you do take longer with somebody, right? If there's suicide ideation. And then I could hear my timer beeping. So I would know how much time I'm passing because I found
Mhm.
when complicated people like that and went extra, then I would lose all sense of time in the day of like how long far behind I was. And then you get into this like, I'm so far behind. What's the point in rushing now? So it helped in that way. It helped me like maybe a bit of a gamify because I only had a few minutes for, it's 6 minutes history, 6 minutes physical, 6 minutes
Mhm.
plan, that kind of thing. Um, and then over time, it helped me learn how much 18 minutes was or 10 minutes in a shorter appointment. It helped me actually start to learn that time. So
Mhm.
the times when the timer didn't function or I didn't press the start or something, I started to get a feeling that I'd never had
Mhm.
before of the passing of that amount of time.
Yeah, that's really good insight. So this was training that you did post grad. You're able to train your brain to know what does 10 minutes feel like? What does 18 minutes feel like? You're able to use an external tool. Is that the tool that you're still using?
Well, it's not as needed now because we have our computers in front of us and the EMR has that time on it,
Yeah.
progress note. So then I can just keep track of it then. So I actually don't set up the vibration
Mhm.
on the watch anymore. Just use the same principles looking at the timer. But if my screensaver goes dark or I've scanned up to look at something or pulled up a document of their MRI and I lose that, how much time is
Mhm.
passing, it's tricky.
Okay, that's really good because I know that sometimes we get blinded to the tools that are helping us as well. And so being able to say, well, listen, there's other strategies that help too. On-screen timer worked, my vibrating watch worked. But this is all really, how long do you think it took you to be able to, that watch going off at the 10-minute or 18-minute mark and you knowing how to kind of wrap that up to get that time back? How long did that whole process take you?
The process of me thinking about how I came up with that, or
Know that you're actually implementing it. The watch would go off and you'd wrap it up.
yes. Um, I guess I'm not totally sure what you're asking. Does
Well, I
it,
know
am I,
that sometimes we are used to spending 40 minutes in a room with a patient when we only had 20. And
yes.
so to have to adapt your style of being in a room with a patient and all the things you're saying and the way that you're doing things so that you're getting closer to that, fitting it into the real time. And just having a watch go off at 10 minutes, I get a lot of doctors say, or providers say, yeah, but I'm not even close to done.
Oh, I see.
I've still got 20 minutes of appointment in front of me and my watch is telling me to wrap up.
Right. Yeah. So sometimes when I get that feeling, then I'm like, oh, it's an indication where, yeah, I won't. What's the point in me even starting to assess a new thing? I
Yeah.
have to just piece it together. So if it's a mental health thing, did I give the crisis line? Did I do the things? And then really you'd want them to come back anyways. So
Mhm.
it helps me with decision making of what is the most important thing to ask instead of,
Mhm.
in residency, you memorize this list of things to ask for mental health. You have to choose just a couple. So
Ah,
it helped that way. Yeah.
yeah.
And
So it
then I
helped you prioritize and focus in. Yeah, I like that. That's really
Mhm. Yeah, it
interesting.
was like,
Yeah.
oh shoot, the time is up. So yeah.
Yeah, what is the most critical things I still need to know? How do I get you safe and out of here? And then I will get you back and do the rest. Yeah, interesting. That's a really very, very interesting skill set that we can learn after graduation. So it's possible, you guys, to be doing things in a new way. It's just interesting to hear how someone's put that into practice so you can have an idea how to do that for you too.
And
Yeah.
then and breaking that first piece into thirds of history physical exam. And we all know the physical really doesn't usually take that much unless it's a special area. But so I would kind of use the history for, especially for the talkers, I kind of let them talk based on, and then if they were not getting to the critical questions that you need to ask, the red flag questions, then I would kind of gently kind of cut them off, direct them to those, or
Hmm.
I would like sneak into my physical exam period, and that's my time to ask the questions because they were giving me my answers just in different order or something. So it helped break it down into that. And oh shoot, it's the management time now. I need to do the management stuff, even though I'm curious about some more things in the history.
Yes. Yeah, and to be able to get that clarity later. So being able to do things in a different order. Yeah, super good. Okay, tell us about Chatting Champions. I know you're a member of Chatting Champions. What was it that Chatting Champions What was it? What else had you needed that was within the program?
I did do the module so long ago.
That's okay.
So
It's all
I
good.
do have to say, yeah, I feel badly because there were so many takeaways. And actually, I started working through the modules a few months ago over again and then have stopped. So I do appreciate that lifelong membership. But just recently, I had a patient that I had to fire, and he was very difficult. And I remember that we had that module on the difficult person, and it was you do you and I'm me and I have to do this and, to try to de-escalate. And so I found that helpful and I listened to that one again. Um, there was another thing that I just thought of. Um, the brain pain thing is really helpful.
Mhm.
Yeah, to
Yeah,
kind of,
that our brain hates pain and loves pleasure and does things efficiently. Yeah, yeah. Yeah, exactly. Awesome. Okay. So anything that you would like to leave listeners with, if they also feel like they're struggling with all the things that you kind of talked about within your ADHD and that decision making, so anything that you would like them to know if they're there in the pain of that?
Um, I think I kind of chatted about all of the things. So I would say the three things that I kind of think might be the most helpful is to understand your strengths and your weaknesses, because both are really important. They even directed my life. I was thinking a merge, and then I found the multitasking so challenging, and I went into geriatrics, which I wasn't thinking at all, but then I can do my deep dives into my thorough things. And then the reframing and being more positive is very helpful. And then the emotional or spidey sense that you get with certain things in
Mm.
my inbox.
I love that Spidey sense. I just love that the way that you created something that is the worst part of the day, the thing you really
Yeah.
want to avoid, and you're like, I'm going to get that done first. It's just such a brain twist on that reframe. It's clever. It's very, very clever. And I thank you for the reflection of what it took for you to create sustainability in your workday and some of those really big obstacles that you faced along the way, and the way that you used all of the different ways of helping you, and you weren't shy to try new things. And I value just the work that you've put in to create this for yourself.
Thank you. And
Yeah.
I've enjoyed this talk. You're kind of like a celebrity because I see you sometimes on the computer TV and I'm doing the modules, and so it's very cool.
No, it's been wonderful having you here. All right, everybody, have a wonderful rest of your week, and thank you so much for joining us. Bye. Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have charting champions for physicians and smarter charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.